All right, welcome to this explainer. We are diving straight into the invisible, kind of mind-blowing world of how your body reacts to medicine. I mean, have you ever actually stopped to think about what happens the second you swallow a pill?
It's a question we've literally all asked ourselves. And to find the answer, we're going to explore the fascinating cellular interactions that keep us healthy. Somehow, a tiny little tablet travels through your entire system and knows exactly which pain signals to block or which blood vessels to relax. It's wild.
Okay, here's our roadmap for today. 1. What is pharmacodynamics? 2. The locks and keys. 3. The domino effect. 4. Dialing in the dose. And 5. Cellular friends and foes. Let's get right into it.
So looking at the Greek roots, this whole explainer is really just about decoding the power of the drug. When we say pharmacodynamics, we're specifically talking about what a drug does to the body, whether that's happening outside the cell, right on the membrane, or deep inside the nucleus.
Section 1. What is pharmacodynamics? Direct versus indirect action. Let's start with the absolute basics of how a drug actually pulls off its effect.
It's actually really fascinating to contrast a simple chemical reaction, like an antacid using direct action to just soak up stomach acid, like a sponge, with the complex, indirect actions that most of our medications rely on. Indirect action requires a highly specific cellular communication system. Which brings us to Section 2, the locks and keys, understanding receptors. This is the core metaphor of our explainer and the absolute foundation of indirect drug action. Think of a receptor as a highly specific lock on a cell, just waiting for the absolute perfect chemical key, or ligand, to bind to it. Their entire job is to essentially catch the drug passing by and pass a message along, telling the rest of the cell exactly what to do. Now, these locks basically fall into 4 main families. You've got enzyme-linked receptors that trigger multiple activities at once, ion channels that pop open in an absolute flash, G-protein-coupled receptors that amplify signals, and those long-lasting nuclear receptors that can literally alter genes. Notice exactly where these 4 families live, ready to receive those messages. The first 3, the enzymes, ion channels, and G-proteins, they sit right on the cell's plasma membrane, acting kind of like border guards. But the nuclear receptor, that sits deep inside. A drug has to physically push through the cell membrane just to reach it.
All right, Section 3, the domino effect, signal transduction. Let's see how this all builds up when a key actually turns the lock inside the cell. Once that drug binds, it sets off a massive cascade, a lot like knocking over a row of cellular dominoes. Take a G-protein linked system, for example. The chemical signal hits the outside, changing the receptor's shape. This displaces GDP with GTP on the inside. Then, that newly active G-protein tags an enzyme, waking it up to do its job.
The really crucial takeaway here is that this mechanism acts like a massive biological amplifier. It takes a single, tiny chemical signal and turns it into a major cellular response. Literally, just one single activated receptor can wake up an enzyme that then goes on to create thousands of internal signals. We call these internal messengers second messengers. While the drug itself is the first messenger that stays on the outside, messengers like cyclic AMP or calcium carry those instructions deep into the cell's machinery to make the actual biological change happen. Moving on to Section 4, dialing in the dose, the numbers of safety. You see, knowing how drugs work is really only half the battle. We also have to precisely measure their power. Because in pharmacology, a few milligrams can literally be the difference between healing and harm. So the ED50 is basically our magic number for relief. It represents the exact dose where half the maximum desired effect is achieved. This gives doctors a really solid baseline to understand exactly how much of a drug is generally needed to actually help a patient. But turn that dial a little too high and we hit the TD50 or LD50, which measure toxicity and lethality. This is exactly why precise dosing is absolutely critical. Researchers have to find that TD50, where a drug becomes toxic, and the frankly terrifying LD50, where it becomes lethal. And that introduces the therapeutic index. This is the crucial safety gap between the curve for healing and the curve for harm. Basically, the wider the gap between the effective dose curve on the left and the toxic dose curve on the right, the safer that medicine is for everyday use. Now, keep in mind the difference between efficacy and potency. Efficacy is all about the maximum power of the drug. Think morphine's ability to completely stop severe pain. Potency, on the other hand, is simply about how much of the drug you need to take.
Aspirin is great, right? But its efficacy stops at mild to moderate pain no matter how much of it you swallow.
Finally, Section 5. Cellular friends and foes, agonists and antagonists. Let's look at how different drugs actually compete for these cellular locks, because, well, not every chemical wants to turn the machine on.
An agonist is essentially a cellular friend. It fits the lock perfectly and mimics the body's natural signals to turn on the machine. It has high affinity, meaning it absolutely loves to bind to the receptor, and high efficacy, meaning once it does bind, it gets the job done. The agonist binds seamlessly, sparking that exact domino effect we talked about earlier. It fits right into that receptor pocket like a custom-tailored key, signaling the cell to elevate your heart rate, reduce pain, or really whatever biological task it was designed to initiate.
But an antagonist? That's a lot more like a cellular bouncer. It jams its way right into the lock, but doesn't turn it. It completely prevents anything else from getting in. It definitely has the affinity to grab the receptor, but absolutely zero efficacy. No signal gets sent.
By hogging that space, the antagonist neutralizes the receptor's ability to receive other signals. As long as that blocker is sitting there, not even the body's natural agonists can get in to activate the cell. It's a pretty brilliant way to stop an overactive biological process right in its tracks.
So, as we wrap up this explainer on the incredible power dynamics inside your cells, it leaves us wondering about the ultimate adaptability of the human body. Think about it. If you flood the body with agonists, it decreases its own receptors. Flood it with blockers and it builds more receptors just to try and hear the signal. It's this constant, brilliant tug-of-war. If prolonged drug use forces our body to upregulate or downregulate its own receptors to compensate, who is really in control? The pill or the body itself? I hope this gave you a brand new appreciation for exactly what happens every time you take a medicine. Thanks for joining me for this explainer.